I'm going to be your nurse today. What's your name? John. How old are you, John? 5 years old. It's nice to meet you. My name is Sarah. Do you want to shake hands? Okay. I can see that your mom is here with you. Very nice. So today we're going to be doing a well check assessment on you. That just means like a checkup, okay? So all I'm going to be doing is assessing all the different systems of your body to make sure everything is going okay and you're developing normally, okay? Does that sound okay? Nothing's going to hurt. There won't be anything painful. I'm just going to listen to your tummy and your lungs and assess your strength and stuff like that, okay? Let's get started. So to begin my assessment, I'm going to make sure that in the room we have all of our emergency equipment. So we have our suction over here, we have our oxygen tank. The bed rails are up so the patient is safe. And there's an ambu bag present with the appropriate size mask for our patient. Okay, can I see your wristband, John? Can you tell me your first and last name? John Smith. And your birthday, do you know when that is? August 5th? Very good. Okay, so we've confirmed the patient's identity. Now I'm going to take his vital signs. So let's hook you up to the vital sign machine. Got your blood pressure, your pulse ox. Put this under your tongue to take your temperature, okay? It's under your tongue. So heart rate is 105. Blood pressure is 120/80, temperature is 98.6, and respiratory rate is 20, all within normal range, so it's great. Next I'm going to inspect your general appearance. So your face looks normal, there's no asymmetry, nothing's going on with your ears or your hair. I'm assessing your skin, there's no signs of skin breakdown on your arms, your legs. I'm going to look at your tummy to make sure there's no scratches or anything on it, okay? Can I have you turn to the side so I can look at your back too? Thank you. Now skin breakdown on the back, the head and neck, ears, eyes, nose, and throat, all good. And the skin is not pale. Okay. So now I'm going to talk to you a little bit about your developmental milestones. So since you're 5 years old, can you stand up for me and show me how you hop on one foot? Very good. Okay. And then I have a piece of paper here. Can you draw on it a triangle and a circle and a square? Perfect. Those are beautiful shapes. Good job. So those are gross and fine motor milestones, Mom, and he's right on track with those. That's perfect. The child's behavior appears normal with Mom. Okay, now let's go into your neurosystem, okay? I'm going to assess your strength. Neuro goes with your brain, okay? Can I have you squeeze my fingers? Ooh. Very good. Can you pull them towards yourself, your fingers? Oh, very good. You're nice and strong. Now I'm going to go down by your feet. Can you pull your feet back towards yourself? Good. Now I'm going to put my hands under your feet. Can you push down on the hands? Very good. Okay. To assess your coordination, I'm going to have you high five me over here. Good. And over here. Very good. And I saw you write your shapes. That was great. We're not going to assess your fontanelles because those are already closed because you're 5 years old. Can you tell me where you're at today? The doctor's office. Good. Can you tell me why you're here? It's just to get a checkup, correct. And can you tell me what today's date is? Do you know? Good. It's March 16th. Yes, or Glasgow Coma Scale would be 15 full points. His eye, verbal, and motor responses are all what we'd expect to see. The next thing I'm going to do is I'm going to take out my little pen light and I'm going to assess your vision. Here we go. I'm just going to have you look straight ahead towards the clock over there, okay? I'm going to shine a little light in one eye just to see if your pupil's done. And I'm going to have you look over there. Now look at my pen. So pro-left. Pupils are equally round and reactive to light and accommodation. Are you in any pain right now, John? No? But if you had to rate your pain from 0 to 10, what would you rate it? 0? Okay, perfect. And then this child has no history of seizure, stroke, or restless leg syndrome. The child has a normal airway. He's breathing on room air because this is just a normal assessment. Chest expansion has been symmetrical throughout the visit. Respiratory rate is 20. The child doesn't appear to be using any accessory muscles when breathing. No extra effort. Breath sounds. Let's listen to your lungs, okay? I'm just going to place this little stethoscope. You want to feel it? Yeah, so I just use this to listen to your heart. So take a deep breath. Listen to your heart and your lungs using the stethoscope. We can also listen to your tummy to hear how your food's digesting. So breath sounds are normal, no adventitious sounds. For the heart sounds, I'm looking at the stomach and the abdomen, and it looks like it is symmetrical. I don't see any distension or anything. I'm going to go ahead and listen now to your tummy, okay? So bowel sounds are normal, active. This child doesn't have any other symptoms like chest pain, so we don't need to worry about that. There's no cough present. Heart sounds that were audible were S1 and S2. I'm going to feel for your pulses now, okay? So we're going to feel for the brachial pulse on both sides. And feel for the carotid one more time. On both sides. So with your pulses, I'm just feeling to make sure your blood is it's circulating properly. If I can feel your pulse, that means your blood can get there easily. No. So pulses are 2+ throughout. That's great. Now I'm going to check the capillary refill. That just means how quick your circulation returns when I squeeze your finger on each hand. Okay, just a little pinch. You're doing a great job. Okay, so capillary refill is 2 seconds in all extremities. That's great. Skin color is normal for our race. The abdomen was soft, and the bowel sounds were normal, active. The skin's temperature is warm. The child displays no edema. And now I'm going to palpate for all of your lymph nodes, okay? So I'm just going to feel on your face, because you have all these different lymph nodes that are in the cervical chain, which means your neck, okay? When a lymph node sticks out, that can be a sign that maybe you're getting sick. But lucky for you, I don't feel any sticking out, which is a great sign. I'm going to feel under your armpits now, because there's some under there too. And then here. And then this child doesn't have any additional cardiovascular problems. So we are now going to, I'm going to feel your tummy to make sure there's no discomfort. Now that I've listened to it, I'm going to feel it, okay? So when I feel it, you let me know if you feel any discomfort. You tell me it hurts there, okay? It shouldn't hurt. So this is light palpation, the abdomen. No pain? Okay, good. Now I'm going to do it just a little bit harder, and you let me know if it hurts anywhere, okay? And now this is deep palpation. Feel okay? Just a little pressure? Okay. So that's all good. I'm gonna feel for your liver, your spleen, and your kidney now. So your liver is over here. Other GI problems. They're not complaining of stomach pains or anything like that, so we're all good. Can I just have you open your mouth and say cheese so I can see your teeth? Up here well taken care of. He's not missing any teeth. His gums are nice and pink. Okay, now we're gonna do something a little bit more fun. I'm gonna assess your range of motion. So can you lift your arms and go like this with them? Good. Can you hold your arms up? And then let them fall down. Good. Can I have you squeeze my fingers? Very good. Can you push my hands away? Good. So in the upper extremities, strength is all the way 4+. Now on your legs, can I have you lift one leg? Good. And then lift the other. Very good. My hands. You bring your feet back towards yourself. Very good. Okay, so range of motion, all 4 extremities is intact. Can I have you bring your head forward and back? Show me your neck works good from side to side. Good job, buddy. Okay. Now we're going. This child's gait is normal. I've witnessed it as he came into the room. And the child does not use any assistive devices, so we don't need to worry about that. We already assessed the skin for breakdown. The texture of the hair is soft and well taken care of. The nails are in great condition. The child doesn't bite their nails, so there's no additional integumentary problems. I'm almost done, buddy. Now I'm just going to assess your cranial nerves, okay? So we already assessed cranial nerve 3 when I had you look into my little light. But now I'm going to have you follow my pen with your eyes, okay? So I'm going to do an H. Let's see if the eyes can follow. Good. And now I'm going to have you blink your eyes and open your mouth for me. Ah. Okay. It's cranial nerve 5. I'm going to assess cranial nerve 7 now. Can I have you lift your eyebrows and lift them up and down? Good job. Okay. Now cranial nerve 8. I'm going to have you close your eyes and I'm going to make a sound and you let me know which side you hear it on, okay? So close your eyes. On the left? Good. Okay, keep your eyes closed. Let's try again. Nerve 8 is intact. Now cranial nerve 9 and 10. Can you show me how you swallow? Can you say ah, and then can you show me gulp? Take a gulp down. Good. Yeah, so your swallow reflex is intact. And then cranial nerve 11. Can I have you shrug your shoulders up and down? Can you do that? Great. You're shrugging up and down. I can see that it's symmetrical. It's perfect. And then last one, cranial nerve 12. Can I just have you stick your tongue out all the way? Very good. I know that's kind of silly. Okay. So the last thing I need to inspect is your private parts. So since it's your private parts, I'm going to make sure we close the curtain in the room and make sure all of our windows are covered. You have mom right next to you. I'm going to have you put this blanket over you, but you're going to take your pants down. And then when you're ready, we're going to pull your blanket down a little bit just to inspect the site and make sure nothing's going on, okay? You all ready? Okay. So I'm inspecting the child's genital area and everything looks normal. The scrotum appears midline of testicles enlarged. I'm gonna lightly pop it, okay? No discomfort is felt by the patient. The patient doesn't wear diapers, so there's no diaper rash. The anus appears normal. And last thing, I'm gonna feel on your bladder, okay? does not appear to have urine retained in it. Is there anything we missed? Let's see. This check is all done. Do you have any questions for me before we're finished, John or Mom? You did great today. Nothing hurt, huh? It was an easy assessment to get through, right? High five. You did a good job. I have a sticker for you, okay? Mom, any questions? Everything appears normal. No developmental delays. Everything in my assessment came back the way that we want it to, okay? Thank you. And then hand hygiene before I leave the patient's room. Then remove gloves if I had them on, which I would because I was inspecting the genital area. Thank you.